Welcome everyone to today's webinar, How Hospitals Can Collect All the Money They're Owed. I am Brian Zimmerman with Becker's Hospital Review. We will begin today's webinar with a presentation and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. We are looking forward to hearing your questions. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. At this time, I'm pleased to introduce today's presenter. Chris Hart currently leads the product and development teams at eSolutions, where he's responsible for overseeing strategic project development and managing eSolutions' ever-expanding product suite. Chris also drives eSolutions' strategic partnerships and acquisition strategy. He's a Nashville native who enjoys working in software because it offers an opportunity to solve operational and technical problems that improve the performance of businesses. He's excited that the healthcare industry has reached an inflection point where information can be aggregated, exchanged, and analyzed in ways that improve the quality of care while reducing the total cost of care. At this time, I'm pleased to turn the floor over to Chris to begin today's presentation.
Great, thanks Brian, and thank you for the kind introduction. Also, thank you to the entire Becker's team. We're excited to partner with you today on this webinar. So why don't we jump right in. Good morning everyone and welcome to our webinar on revenue integrity. We decided to title this presentation, How Hospitals Can Collect All the Money They're Owed. In hindsight, that's probably a bit of an ambitious title. What we will talk about today are some of the core elements of a revenue integrity program that every hospital provider should implement. When done correctly, a revenue integrity program can increase a hospital's revenues and decrease their uncompensated care, and by extension, a hospital's bad debt. So let's take a quick look at the agenda. We have about 60 minutes together today. We'll plan to use the first part of that time on the content we've prepared, and then we'll plan to use the remaining time for any Q&A. And like all good webinars, we'll try to end a few minutes early. So on to the agenda. We'll start today with a brief overview of eSolutions. We'll talk about the market's definition of revenue integrity, as well as our own. We'll spend some time talking about insurance discovery, which should be the starting point of any revenue integrity program. And then we'll take inventory of a variety of tactics a hospital can adopt to maximize their Medicare reimbursement. As part of that discussion, we'll focus on transfer DRGs as a specific opportunity that every hospital should be pursuing today. We'll close with a handful of key takeaways and then open the line up for Q&A. So let's get started. So who is eSolutions? eSolutions is a revenue cycle management company that was founded in 1999. We've spent the last 20 years helping healthcare providers get paid quickly and accurately. Today, we help more than 500,000 providers across the country and across care settings. Well, I think about the company as having four primary product families that you see below. For our purposes today, we'll briefly discuss two of them, our Medicare RCM technology and our claims and clearinghouse tools, before jumping into revenue integrity. eSolutions' core business is Medicare, and specifically helping healthcare providers get paid on their Medicare Part A and Part B facility claims. We are a CMS-approved network service vendor, or an NSV, so we are uniquely credentialed to access, edit, and extract data from Medicare's claim adjudication system and common working file. We use our access to provide daily claim status, systematically identify RTP and ADR claims, and edit those claims directly within Medicare's claim adjudication system, helping healthcare providers get paid faster. As we get into the webinar today, we'll discuss why working with an organization that is an NSV is incredibly important to enabling an efficient and, more importantly, an automated revenue integrity program. Next, eSolutions has a broad set of all payer claims management tools and clearinghouse capabilities to help our customers submit clean claims electronically. The exhaust of these two businesses is healthcare data, and specifically claims, 835s and 837s. Like many vendors in the revenue integrity space, we use this data and our clearinghouse connections with payers to power our revenue integrity solutions. So that brings us to our topic today, revenue integrity. So this is our credibility slide. We've worked with more than 1,000 hospitals and health systems, and when it comes to revenue integrity, we've helped our clients recover more than $1 billion in underpayments. Revenue integrity to us is all about finding missed reimbursement opportunities and helping healthcare providers capture it. So, what is revenue integrity and why is everyone talking about it? Well, like everything in our industry, there's an association. And in this case, the National Association of Healthcare Revenue Integrity. Their definition is, the basis of a revenue integrity program is to prevent the recurrence of issues that cause revenue leakage and/or compliance risks. I think that's a pretty good definition. The important piece here is the balance between revenue leakage and compliance. Any revenue integrity program needs to have this double mandate, and when it's done appropriately, it can. In fact, HFMA just released a survey of about 125 hospitals and health systems on this very topic. They found that on average, about 2/3 of the hospitals reported an increase in revenue and a corresponding decrease in compliance risk when they implemented a revenue integrity program. So we know it can be done. So, how do we break down revenue integrity as a category, and where do we start? On the right is how we at eSolutions think about revenue integrity. Any revenue integrity program should have 3 components to it. First, insurance discovery. Second, Medicare underpayments. And third, payment optimization. The starting point or the foundational element has to be insurance discovery. No other single tool can generate as much ROI as an investment in insurance discovery. This is how a revenue integrity program can reduce uncompensated care and, more importantly, find billable insurance coverage on a seemingly uninsured population. Second, the revenue integrity program needs to consider Medicare underpayments. While hospital payer mix has shifted over time, Medicare continues to be the largest single source of reimbursement for most healthcare vendors or providers, so it's critically important to ensure that you're collecting every dollar you're owed by Medicare. Lastly, a complete revenue integrity program needs to consider payment optimization. Revenue integrity has traditionally required a lot of manual work. When there are opportunities for automation, I strongly encourage you to consider them. Even small steps can add to big improvements in operational efficiency and performance. So, let's talk a bit more about insurance discovery. Today, hospitals write off billions of dollars every year to uncompensated care. In 2017, which was the last year the American Hospital Association released data, U.S. hospitals delivered more than $38 billion in uncompensated care. While the care is life-saving, the corresponding bad debt can be crippling to a hospital's financial performance. Worse yet, when a patient doesn't have insurance, a hospital is typically left with no other choice than to bill the patient directly. The patient can end up being responsible for thousands of dollars. One of the unintended consequences of this is, unfortunately, medical bankruptcies. In fact, more than 2/3 of bankruptcies last year were the result of unexpected medical bills. Unfortunately, it impacts more than 500,000 families every year. The good news is we can help prevent some of these. Insurance discovery solutions typically find between 5 and 12% of accounts have previously unknown insurance coverage. The best tools can find Medicaid, Medicare, and commercial coverage. Typically, these solutions find missed coverage in 3 places. First, let's talk about Medicaid. Medicaid detection takes advantage of something we call latent Medicaid coverage. While the rules vary by state, on average, state Medicaid programs provide coverage starting up to 3 months prior to the beneficiary's Medicaid application date. So even if a patient did not have Medicaid coverage when they visited your facility, they may have been recently enrolled in Medicaid and their coverage is retroactive. Second, Medicare coverage can be found by converting a patient's Social Security number into a HIC number and then subsequently a Medicare Beneficiary Identifier, or MBI. While this feels like a bit of a daisy chain, many Medicare beneficiaries need help looking up their MBI, which is required for any billing. Lastly, commercial coverage. This one can be a bit tricky. Typically, how commercial coverage is found using insurance discovery is by looking at reference data. This is typically made up of claims data, again, those 835s and 837s. If the patient has been seen before, the patient's insurance can be verified directly with that private payer. So, who can provide insurance discovery solutions? These are the usual suspects: Experian, TransUnion, eSolutions, and Change Healthcare. I want to stress that this is not a comprehensive list, but instead represents the largest vendors in this space. While I won't discuss everything on this slide, I do think there are a couple of items to keep in mind when contracting with an insurance discovery vendor. First, as I mentioned previously, each vendor uses reference data. That reference data is proprietary to them. And so, second, each of these vendors has their own search methodology. Specifically, they use an approach called probabilistic matching. They look for common errors in the data like misspellings or transposed numbers on a patient's date of birth or social security number. What this means is no two vendors are the same. Although each of these vendors advertise similar hit rates, 5 to 12%, they're not finding coverage on the same accounts. There is definitely overlap, since each vendor takes advantage of their own data assets and their own search methodology. And so, when we take a step back and we work with hospitals and health systems, our recommendation to them is always the same. Work with multiple vendors. Have a primary and have a secondary vendor. In fact, you're going to see that as a theme today as we go through the slides. The best revenue integrity programs have redundancy baked right in. One way that we think about revenue integrity here is it's a bit like sweeping the floor. Every time you do it, you'll pick something up. So to illustrate that, we wanted to provide a couple of examples of where we've worked with health systems and we've been in first, second, or third position. I'm confident that the other vendors on the previous slide, TransUnion, Experian, and Change Healthcare, have had similar experience, which is, regardless of position with insurance discovery, billable insurance coverage can always be found on patients that would otherwise be written off. So the examples we have here are a couple of standalone facilities as well as a large health system, and in each case, we were able to find between 11 and 14% of the accounts we reviewed had coverage that was otherwise unidentified. So, we'll switch gears a bit. If insurance discovery is the starting point on your journey to building a revenue integrity program, Medicare underpayments is the next point of interest. A complete Medicare underpayment strategy has an investment in each of the areas shown on the slide. I like to think of this strategy as taking advantage of two different opportunities. One is the data-driven analysis of your own Medicare claims, and two is the maximization of the inpatient prospective payment system. Today, we'll focus on the inpatient prospective payment system, or IPPS, and within that, we'll specifically spend time on transfer DRGs. But I do want to make mention that this program includes a number of other opportunities for a healthcare provider to maximize their Medicare reimbursement, like IME/GME for teaching facilities, Medicare bad debt, DISH, and outlier payments. Every Medicare underpayment strategy should consider each of these items on this slide when putting together a comprehensive plan. So, let's talk about transfers. What is a transfer DRG? There are a subset of about 270 DRGs where Medicare underpays a hospital. Medicare does this with the expectation that a patient will be transferred from the hospital to a post-acute care provider. If for any reason the patient doesn't go to the post-acute care provider, the hospital has an opportunity to correct the claim and receive additional reimbursement. I want to take a moment here to stress that missed transfer DRGs have nothing to do with a provider's business office, but rather is solely the result of patients failing to adhere to their discharge instructions. On average, we find that for every claim that we can identify as a transfer DRG, there is approximately $3,500 in additional reimbursement when that claim is corrected. Further, in most instances, you can review and correct up to 4 years of old Medicare claims. So these $3,500 can really add up. Generally speaking, we find hospitals try to find transfer DRG opportunities themselves, but they're often relying on resources that are stretched thin, lack experience, or suffer from high turnover rate. The best run shops that we partner with work with third parties to augment their internal resources and ensure that they're capturing all of the Transfer DRG opportunities. Like in many things, experience is the best teacher here, and we find that organizations that partner with a specialist will always outperform their peers. So, who can provide Transfer DRG services? There are 4 primary vendors in this space: TransUnion, Bessler, eSolutions, and Revant. From time to time, we also run into professional services firms like PwC and EY who offer Transfer DRG services as well, but it's typically not part of their core business. Like insurance discovery, our recommendation for Transfer DRG is to have a primary and a secondary vendor. Each vendor has their own search criteria for finding claims that can be corrected. And more importantly, we find that by contracting with multiple vendors, a hospital can keep both of the vendors honest. It forces the vendors to search all claims as opposed to cherry-picking only high-dollar accounts. And more importantly, it keeps the fees more competitive. To illustrate the opportunity of having secondary vendors, just like insurance discovery, here are 3 examples of where we, Solutions, have worked with hospitals either in primary, secondary, or in third position. In each of these opportunities, as we swept the floor, we found additional reimbursement for our hospital customers, many times adding up to millions of dollars. Lastly, I want to spend a few minutes talking about some key considerations that we recommend you keep in mind when picking a Transfer DRG vendor. The first is whether your Transfer DRG partner is a network service vendor. Oftentimes, Transfer DRG work requires working within Medicare's common working file, and so it's important to work with a vendor that CMS has approved for direct access. Further, if your vendor is an NSV, they can significantly reduce the operational and IT burden on your staff. As an NSV, your partner can get all of the data they need to run a Transfer DRG program. It makes the service completely touchless for the hospital. No manual data dumps or file transfers which contain sensitive PHI are required. Second, and I can't stress this enough, it's important that your partner focuses on the common working file. It's easy to get distracted by medical records, but it's CMS's view that the common working file is the single source of truth when it comes to Transfer DRGs. Where we've seen audits and clawbacks, it's almost always the result of folks being over-reliant on medical records. Lastly, in January, Medicare finally completed its transition of the HIC number to the MBI. Today, all Medicare transactions require an MBI. So you should look for a partner who can systematically convert HIC numbers to MBIs. This becomes critically important when a Transfer DRG vendor is working old Medicare claims as part of that 4-year look back. Many of those claims have HIC numbers. If your vendor can't convert those to MBIs, they'll be unable to verify if that claim can be corrected, and as a result, they will recover less money for you. We found that by systematically converting HIC numbers to MBIs for our clients, we can recover more than 20% than our peers on average, and in some cases, much more than that. Lastly, something to keep in mind, not just for Transfer DRGs, but for insurance discovery and your broader revenue integrity program, is there's a sense of urgency here. If we think about transfers, for example, we deal with timely filing. We're working with a health system today where we've identified more than $3.5 million in potential recoveries. Today, about $215,000 in that is expiring within the next 4 months. And so there's a real sense of urgency, a real time to act. Otherwise, you will be losing money. So, as promised, tried to keep this short and sweet. So a couple of key takeaways. 1, have a plan. 2, have a sense of urgency. And 3, as you think about your revenue integrity strategy, whether it's related to insurance discovery, Transfer DRG, or a broader approach to Medicare underpayments, use multiple vendors. So that's our presentation today. I wanted to thank you for letting me to share some of our recommendations and experience working in revenue integrity. While we're getting organized on the questions you're sending in, I did want to mention Insurance discovery is the starting point, and we'd be happy to work with you to do a free assessment of your bad debt to see if we can help you recover some additional dollars that you're owed. Feel free to email us at revenueintegrity@esolutionsinc.com, and we'll follow up with some simple next steps. All right, on to a couple of questions.
Thank you, Chris. Appreciate that excellent presentation. And we will now begin today's question and answer session. Please submit any questions you have by typing them into the Q&A box you see on your dashboard, and we really appreciate you all participating today. So, Chris, the first question I'm going to take here, the attendee asks, if your Transfer DRG services don't use medical records, doesn't this cause compliance issues?
Okay, so great question there. I was hoping someone would ask about this. So, medical records only really show what happened inside your hospitals. Hospitals have very little insight to what happens once the patient is discharged from the facility. So the CMS Common Working File contains all the claims billed to Medicare from the hospital, as well as any post-acute care providers. So the entire patient history is available right there. Medicare evaluates the request to adjust the claim against the Common Working File and is exclusively using this data. In fact, MLN Article 3240 specifically states that hospitals will not be found out of compliance for changing a patient's status codes due to Common Working File edits 7272, even if the patient's medical record does not support the change. And so it's critically important to think about the Common Working File as your source of truth here while working on Transfer DRGs.
Some important points there, Chris. Thank you. The next question I have here is the attendee wonders, what do you mean when a touchless solution regarding your Transfer DRG service? So what do you mean by a touchless solution regarding your Transfer DRG service?
Right. So as an NSV, eSolutions has direct hooks into Medicare's Common Working File and claim adjudication system. And so if a provider is working with an organization like eSolutions or another NSV, once that client's onboarded, that healthcare system or provider will never have to send a data file again. An NSV or eSolutions can perform a Transfer DRG solution without any further assistance from the provider's staff. Part of the advantage of working with a CMS NSV. No more file transfers, no more sharing data files with sensitive PHI in them.
Thank you, Chris. The next question we'll take here is the attendee asks, does your Transfer DRG solution also help to reconcile and look for additional reimbursement opportunities in situations where the patient does indeed move to post-acute? Or is it only focused on the ones that don't opt into post-acute?
Sorry, Brian, you kind of broke up there a little bit on my side. Would you mind repeating the question?
Of course, no problem at all. So the attendee asks, does your Transfer DRG solution also help to reconcile and look for additional reimbursement opportunities in situations where the patient does indeed move to post-acute? Or is it only focused on the ones that don't opt into post-acute? Were you able to hear me that time?
I did. I got it. Yeah, so while we can look into the kind of opposite situation where a patient was discharged to home, but then went to post-acute care, once the data is found to indicate that the patient went to post-acute care, hospitals must report this as soon as they have the information, which will result in reduced payments.
Excellent. Thanks for that clarity there. The next question I have here is, this attendee says, we are struggling to find the right managed care plans to bill. Can your services help?
Yes. So your insurance discovery partners should be able to help you. They should be able to provide detailed information both on Medicare and Medicaid managed care through insurance discovery.
Great. And I think we can take a couple more here, or let's see here. Let's go with this one. So what is eSolution's success rate on relying on the Common Working File account history instead of internal medical records? You may have touched on this already. but I wonder if we can review again.
Yeah, sure, Brian. We do track this over time. So we've been in the Transfer DRG business for about 13 years. When we look back across all of our work, the number we have internally is 99.5% of all accounts have been successful and in recovering additional dollars for our clients.
Excellent. And so I'll take this next question here. So you mentioned MBI lookup in your presentation. Why do you see this as a problem that will continue?
Yeah, so I certainly think we're in a point in time today where we have a number of Medicare beneficiaries showing up to healthcare providers without an MBI number. And so while there's this near-term need, over time, this will continue to be an issue. And let me give you an example. If a Medicare beneficiary loses their card and requests a new one, Medicare actually terminates their old MBI and a new one will be assigned. So even if a provider has seen a patient before and registered their MBI in their system, if that beneficiary had lost their card and been assigned a new number, they're going to need to be able to look that up. And so there's going to be constant churn in the MBI, in Medicare beneficiaries' MBI numbers over time.
Thank you, Chris. And we've had a bunch of great questions come in. I really appreciate all this great engagement from folks. And so the next question I'll ask you is sort of this attendee is wanting to hear more about moving true self-pay to collection. So the attendee just says, say more about moving true self-pay to collection. So I'll tee that up for you, Chris.
Right. So in our experience, the sooner we can move self-pay patients to collections, either internal or working with a third party, the higher probability the hospital has to collect that patient portion. And so, our recommendation is if you've got your list of self-pay or your list of bad debt, run them through insurance discovery, categorize them appropriately as either having insurance or not having insurance, and then farm that out as quickly as possible. Like anything, as too much time passes between the patient's visit, your collectability on that balance goes down.
Great. And so the next question here is, can your system look up VA coverage?
Yep. So this has been a big issue lately, and our insurance discovery solution here at eSolutions can, and many of the others can as well. This is really important, making sure that you're finding all of the coverage on those patients.
Excellent. Chris, I think this would be a great time just to check in with you. Do you have any final thoughts to share with our attendees today?
Right. So just a couple of things to keep in mind. So as you're building out your revenue integrity program, start with insurance discovery. This is really the foundational element to any revenue integrity program. It's the single investment that generates the highest ROI. As we've worked with hundreds of hospitals across the country, this is where we start. It's certainly where we recommend you start.
Thank you so much, Chris, and I appreciate you taking all those great questions, and definitely appreciate all the great audience participation as well. And that'll conclude our webinar for today. Chris, thanks again, and I'd also like to thank eSolutions for sponsoring today's webinar. Enjoy the rest of your day, everyone, and we look forward to having you join us for future webinars.
Thanks, Brian.